Adibya Srivastav, sorry. Now I will like to invite Dr. Vipul Janardan for the last session. It is a more of a discussion session. Dr. Vipul Janardan is a consultant psychiatrist working at Delhi in the corporate sectors. Before that, he was a senior resident in Institute of Human Behavior and Allied Sciences for quite long time. He is having interest in geriatric psychiatry and some interest in use of technology in mental health. Over to you, Dr. Bipul. We'll be having the questions from the participants, and I will also talk about the ethical aspect of use of AI in mental health care. So, over to you for moderating the session.
Thank you very much, sir, for introducing me. Good evening, everyone. So we are at the fascinating time where the technology is meeting the human mind. The field of psychiatry, which was traditionally mean to be like based on the clinical interview, observation, and the therapeutic relationship, is now reshaped by the artificial intelligence. AI today is not a futuristic concept. We are using it widely, and almost every aspect of life we are using it. Uh, so so it is already influencing our life uh, in day to day way, not only in day to day life but also in the mental health as well. So likewise screening, diagnosing, and even predicting the mental health condition, from chatbot providing to psychological support to machine learning, identifying early sign is speech and behavior that we learn uh, from the pre in this talk. But with these transformations come an important questions: can AI truly understand human emotion? Will AI will complement psychiatrists or it compete with them? So, and most importantly, how do we ensure that it should have empathy, ethics, and patient trust remains central? So today's discussion is not just about technology; it is about the fate of the mental health care. So thank you very much for all the speakers, Dr. Monica, Dr. Surabhi, Dr. Srivastav, and Dr. Malik, for this elaborate and amazing presentation. So how AI can be helpful or useful? So it can be our friend or it can be our foe. So better we make it friendly and help it to make things better instead of AI running us. We can use for early diagnosis, data interpretation, some more support to remote area. One important question arises that how we are flooded with information now. We don't need information. We are flooded with already with information and data. Can AI replace human being? Certainly not. Can AI replace empathy? So these are the things that is still questionable, and all the psychiatries cannot be without empathy. So these are the things uh, is still questionable. So what about most important thing is, and other important thing is data security of the patient and confidentiality of the patients. Algorithm can predict the diagnosis, may be helpful in the data synthesis, but what about important thing that any doctor or any healthcare worker have, that is healing touch? Does AI will be able to provide this? So and during the all our practitioners years, so you might have seen there is a intuitiveness in the patient, in a doctor, so we are not just a doctor. We don't just go by the calculation, we don't just go by the diagnosis. There are a lot of things like experience. So can AI replace this intuitions? So these are the things still questionable, and we should always use AI just as a friend, as an assistant, not completely dependent on the AI. So can AI, and moreover, there are certain other things. There is always the biases that AI generated. So these are the things we have to keep in the mind. So how do we ensure AI tools are culturally sensitive, especially in the diverse population like India itself? So 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 we have request to all the policymakers, stakeholders who are law enforcement to make directives, policies, guidance, or protocols to make policies related to ethical use of AI, keeping confidentiality of the patient at most important and their data privacy. Guidelines should be patient centric. AI can be a tool, and AI can be a tool, and it can also be assistant, but it cannot fully replace human being. We definitely need information, but this wisdom to use this information should be in the hand of a empathetic healthcare worker. So with this, I want to take the questions from the audience.
Okay, maybe I can start my first question. So at what time, and this is something possibly I'd like to ask to Surobi and maybe Monica, at what time will AI be uncontrollable, and how would we realize that? So I think, the complexity, I think some of you mentioned that it's so difficult to check the logic, but when is it that we can't do it anymore? So if Surobia or Monica can answer these questions. And the other thing is, I would like to ask the audience to put your questions into the chat box, and Sujit will mention them. Okay? And is there Surobi available or Monica?
Yes, sir, I'm available. Can you hear me, sir?
Yeah.
Yeah. So, if I talk from research perspective and from my presentation perspective, AI itself is a research. It is developed based on the research. It started from there. So, there is no specific time per se where we can say that at this particular time it will become uncontrollable or it will shift its pace. But when there is no regulation, no ethical compliance, and people are completely replacing their cognitive mind to AI, and there is no data protection, and there is advancement happening, but there is no knowledge is generating, and when there is autonomous decision making is happening with the help of agentic AI. So at that particular time, we feel that it might go out of the hand, because uh, all the AI apps or any chatbot, whatever is developed, that is developed on information, and those information somehow are driven from the human. It is taking my data. I'm providing the feedback. I'm providing more data. So if it is not regulated properly, if it is not end-to-end encrypted, then one time might come when my data, my patient's data, and my research data might be misused. And at the same time, they will completely take the information from there. So it may not become uncontrollable. Some regulation has to come, but if it goes without any regulation, as told in the previous presentation, that China has the most strict regulation, but unfortunately, the most retraction of the paper, highest number, if there is a 100%, then 95% retraction are happened from China, sir. So it also has to be the moral obligation of the people to follow it, because we are humans, sir. As Vipul sir said that nobody can replace human. This is true. But sir, we are somehow beyond AI. If AI is building something and regulation are happening, we try to find a one loophole in that. So it is our moral obligation to find out in which zone we are residing. If we are in a good use zone, then we can continue and then there won't be any kind of harm. But if we are completely depending on it, one time will come when AI will also stop giving answer because you do not have the right question. So that is my answer, sir.
Thank you very much. So one more question from the audience for Dr. Surubi. So this is do you think AI-related cross-cutting studies will become common in India? And one more question, that is also that, do you think ethical AI need to be focused, and who do you think can be the stakeholders for ethical use of AI in mental health? So this
First
is
of all,
question.
thanks a lot, sir. Thank you, ma'am, for this question. So yeah, I think cross-cutting research is currently also a lot of research is now being done, which is at the conglomeration of a lot of things. We are now developing greater tools which are integrating. So that's the term that I was using, digital therapeutic alliance, where actually psychiatrists can work together, can work in alliance with AI, and not just solely give the entire purpose and the entire, the entire machinery to AI itself in order. So we can have it in more regulated way. And talking about ethics, so when we talk about the ethical aspects of it, or the ethical aspects of working, then for the stakeholders, if I want to say, then that's what one of the things for accountability is in AI. Who do we hold accountable? Do we hold the computer programmer accountable, the one who created it? Do we hold the physicians accountable who provided the data sets? How do we hold people accountable? Because it's not just one person, it's a whole set of machinery that goes behind it. And because there's so much loopholes, so much black box things, what I would say that the stakeholders are everybody, and everybody needs to be accountable. As, say, if I am a psychiatrist, I who is providing the data, the people who are using the data, in what way they are using it, the patients for whose benefits we'll be using the data, all of them should have a say in how their data is being managed. And for that, digital literacy is very important, which is something which is coming up a lot in Western countries, because most of these legislations are also now focusing on the same thing, so that we don't monopolize the data. Because ultimately it's all about who has the biggest data set. So if we talk about, we are again and again talking about China and US, so it's the big war, data war that's going kind of thing. Like whoever has more data in the agency will have the upper hand ultimately, and can develop better tools. But and ultimately in the game of everything, are we focusing on patients? So I think all of them will be a stakeholder.
Thank you very much, Dr. Surubi. So any more questions from the
Yeah,
audience?
maybe I can ask again my question directly to Surubi. So when is a black box so black that we can't see anything in there?
I think it's like, it's not about how black. It's, I think we have to realize that a lot of things we are still not understanding. It might be because of the way that we are not very clear about a lot of interpretation of what generates inside AI. So I think when you were asking me question of when will AI be uncontrollable, I think AI is getting uncontrollable in a lot of aspects, and we are kind of ignoring it. We are letting it be. So be it research perspective, where we are generating tons and tons of paper, which, say for example, somebody goes through it and applies it in their patient and ends up getting something. Similarly, a lot of data breach has been happening. A lot of data was leaked from Sweden, from Finland, from India itself. Like, so much data has already been leaked and hacked by these people, who will then tell that they'll take some money or something. So I think AI is already getting uncontrollable in a lot of sense. And in order to better adjust to it, we need to develop better systems. We as physicians, sometimes we don't cater to the computer side of things. We let the computer programmers handle it. We will be safe. We will not take that burden on upon us. But if we don't understand how it is working, we'll never be able to understand what are the loopholes. So that's my perspective on it.
Thank you.
I have a question to maybe any of the speaker, they can answer to it. using AI requires a sensible use of commands and prompts. So now we are learning how to interact with machine, how to design appropriate prompts and commands. Is it going to develop that it's a new way of developing the social skills? Our social skills are improving because a long time criticism to the AI is uh, when a lot of people they are using AI, they are losing their cognitive skills, they are losing their social skills. Now they are interacting with machines instead of interacting with human beings. So social skill is at threat. That is one argument. But the counter argument is because now we are instead of searching the answer, we are framing an appropriate question, which is a lot emphasis given by Greek philosopher Socrates. If you have designed a right question, you will reach a right answer. Now we are focusing more about how to design a better prompt, better command, and interact with the machine. So actually, are we moving in the positive direction in terms of enhancing the social skills? Our social skills are going to improve with this. What's your thought about this?
Um, Okay, so I feel that so if we move from one generation to another, every generation has its own set. So, for example, from Generation Z to Generation Alpha, a lot of using chat systems also. We were telling that the Generation Z is forgetting how to use English language, and they don't know how to use. They are using emojis basically to talk, and we were a lot of debate was happening around it as well. But now we are seeing that we are now getting more accustomed to it. A new sort of lingo, a new sort of language is coming where they are communicating, making it better. So I think with AI also, this new generation is coming up with different sets of questions than the previous generation had. Different sets of understanding and integrating the amount of information that they have, because we are in a cross junction of an era where our previous generation had information but didn't have access to all those information. So now we have access to it, so now we have to understand how to use it. So maybe it can be a soft skill, as we say, one of the soft skills for psychiatrists maybe in the coming up term, where they'll be getting to know, okay, this is how they should use the AI better in order to cater to their people.
I would like to supplement the sir, am I audible?
Yeah, ma'am, you're audible.
Okay. So yes, as you asked, sir, your first part, whether it is a emerging skills or not. Yes, it is an emerging skills because previously we were not even aware about what is AI. Then somehow we got to know about there is something called as ChatGPT. Then we got to know about that this give answer to our question. Then slowly and slowly now we are learning about that there is a way of asking the question. But somehow, if we see, our majority questions are here to just supplement what I want to know. That is the confirmation bias. So it depends on me what question I want to ask and what kind of answer I'm expecting from it. So to reduce those kind of confirmation bias, it is important for us to know that which kind of prompt is required and how to get the correct answer. Because somehow these AI apps are human sensitive, and as I told you, it works on the feedback. So the moment you will give any sort of input to it, it will work on that. So if you will ask that how much sugar is good for me, it will give you the answer exactly like that, because it kind of work in a people pleasing manner. But your correct question should be, what is the ideal amount of sugar for a person? So we should learn what is a right prompt, because nowadays in majority of the companies in IT sectors, they have allowed co-pilot to work in any setting. So it is coming to our workplace now, so we have to work with AI. So if we are not giving the correct prompt, most likely every person will get different kind of answer. So if we get to know about a right prompt, and that we can keep on changing, and sometimes even we can learn how to make the prompt. So as Dr. Surabhi told before, that we have to keep on training our models. So this is what I have learned when I was working with AI company, that until your model improves, you keep on providing and make it biasness free. So yes, as per the emerging need, we cannot replace AI, and we cannot say that it will vanish one day. It will stay here, it will improve. So if it is improving, we can get benefited from it, and why not to learn how to use it better? That's all.
Can I go ahead and place my question, please?
Yes, please.
Yes.
Yeah. Now, my question for you is, how can an AI-driven mental health support be used at the accessible in rural population where still we have lack of smartphones and internet connectivity? Is it still a major hurdle, or how can you overcome this? And could anybody elaborate something called as telemanas? I think Dr. Monica was working with the Nimans, and Madam can elaborate about telemanas. Dr. Monica.
Thank you, Mr. Joseph. Actually, I was working with telemedicine for a very long period of time, and I, started working with telemanas. Telemanas is something which is you can consider it in a short term a kind of a customer care where people can easily access. Like in other country, we have 911, and every country have some or other sort of support. But mental health is an area where such kind of support was not available. And in order to reach a tertiary care center or even a psychologist, a psychiatrist, people first of all doesn't know the route. I have trained more than 5,000 people across different disciplines: doctors, nurses, psychologists, community health officers. So what I have observed in among all those things, that people are not even aware that they have mental health issues. So for such kind of thing, when we trained them, we trained a very basic grassroots level worker, and with the help of that, we were able to screen 2 lakh people. And among 2 lakh people, after screening, we started within 2 years, we started the treatment for 5,000 people. And the largest number, if I can put it, was 12 years. The person was suffering from severe illness, and that person was not aware about it. So telemedicine or telemanas, such kind of field, are bridging that gap. So it is not about that, how to uh, actually provide the best of best service, because the argument initially was that, how come a CHO can do this, how come a nurse can do this, how come a psychologist, we need a psychiatrist. So what I learned from Nimhans and from my mentors, that it is better to provide something rather to provide nothing. So if the people are even able to know. So believe me, one question which startled me, and I was like kind of surprised by that question. One person came with anxiety. I was assessing him. He was in Chhattisgarh, I was here in Bangalore. He asked me, Madam, it is treatable. He had anxiety. So he was completely confused and too much in panic that I have anxiety. So I told him this is an illness and this needs treatment, and then it can be, treated. And he was very much confused whether whatever I'm telling that is true or not. So this particular kind of thing, just imagine, he's a working person, he's educated person, but not aware about it. So in resource poor settings, countries, or where still the infrastructure is developing, telemanas, telemedicine, these settings are actually helping us bridge that gap. Slowly and slowly we'll decentralize it. Initially it is very much centralized, but slowly we'll try to decentralize it and equip the regional centers actually, where those centers can be benefited. And to your next question, that how rural areas can be
That's what,
much
reliance of
better.
phone and internet connectivity,
Yes.
because very limited
Yeah.
people have the access over the internet connectivity, where remote rural areas with poor connectivity or low digital literacy is being seen. So how these
Yes.
people can opt with a telemanas
Yeah.
or any
Okay. So
other AI generated help which they can help in their mental health to support their mental health.
I understand your question. So this is something which we actually faced, right? We have to train even the lower cadre, which was a rural health worker, and many of them didn't have the phone. So what we did, we called them at a center which had the some or other sort of infrastructure, and then we trained CHO, which works better because they are government, worker, and our CHOs 99% are BSc nursing trained people who have studied psychiatry and studied psychology as well. So these people are, even after that, they are intensively trained on mental health, and we have trained them offline and on site. So then we taught them how to recognize. So since they have a field visit, okay, so they will go to the home, and after going to the home, they'll apply a very small, brief checklist, and we'll see whether the person have some issue. And 99% of the time their diagnosis was very much accurate, and it will be surprising to many of the people, but 99% of the time their diagnosis was accurate. They will bring it to the person to the center, because their health and wellness centers are there now. So health and wellness centers are like sub center for every 5,000 population. So those people can come to the sub center and can tell their problem to the people, and their system can be, if not there, then it can be implemented, and then we can use it. So I was watching a series few days back. Actually, it was a Chinese series, and they were actually developing a dental particular app and dental related AI apps, which is predicting the diagnosis with the 95% accuracy. Now, question is, it was implemented in a very big hospital. So the people who are in big settings and the clientele is different kind, they were not ready for it. So what they did, that how we can test it, how we can improve it, because they were very much convinced that it will help. So what they did, that instead of using it in the bigger hospitals, the right population is going to the rural area, going to the areas which are having very poor kind of resources. So those people will get much more benefited with these kind of thing. It, because one, it will be cheaper. Second, it is present at a doorstep to them. And third, they don't have to travel much. Believe me, people doesn't have money even to travel from one place to another. So because of that, people are not taking. So AI, if used properly, it is going to become very much revolutionary. And just one thing, that healthcare people need to understand it. They have to show little less resistant. They have to understand about the use of it and how to implement it. When this will happen, then it will change the game of any healthcare setting which is suffering from poor kind of resource system, because mental health is a huge issue, and day by day it is increasing. So
Okay.
I hope I answered your question.
I hope. Okay.
Thank you so much for the elaboration.
Can I ask Aditya one question? Divya. The question is, some people are, it's about AI dementia. So the question is whether people who sometimes can't understand what's happening around them, whether they will be able to use AI or profit from AI. So if you don't understand, so we had a case where we had someone being supervised with a camera, and the son gave answers, but the demented patient was more confused than having profiting from the directions, because the person was looking for the patient for the son who wasn't there. So I think there might be negative effects of that. I hope this is understood. If nobody, maybe Vipul can answer this question if Adivya is not there.
I think it's not suitable for the who is cognitively declined to that limit that he cannot use the app, but it can be beneficial for their caregiver, who caregiver definitely. So like for in dementia, like assessing task and providing task and or making some cognitive games. So these are the things that is still that lot of apps for dementia has been made. So yes, for them that can be beneficial, and for the caregivers also. And yes.
Okay, I think thank you. I don't know. Do you want to summarize? Because I think we're repeating some of our issues, and I think there are no more questions. I think Vipul, if you want to summarize the discussion and.
Okay, so thank you very much. From so far, we learned that AI is very inevitable and indispensable. We cannot avoid AI, and it already existed in our like day to day and in our healthcare and mental health care definitely. So judicious use of AI should be there. Always keep in the mind, it should be patient centric, and ethical consideration should be there. And from all our discussion, we should through this platform we ask our policymakers, lawmakers, to please make policies wherever across the world, who are listening to our this small short talk about the AI, that they should make the policies related that should be ethical to the use of ethical use of the AI, and it should be patient centric and keeping in the mind of the patient care. And we ask our healthcare workers, maybe psychiatrists, maybe nurses, to use judiciously and make it as a friend, make it as an assistant, rather than wholly relying on the AI, just to help it in the diagnosis or whatever, then the research, whatever that they are doing. So thank you very much for that, and I will hand over to Dr. Sujit and Dr. Ryan. Thank you very much.
Thank you very much, Dr. Vipul. We had a long discussion and meaningful presentation since the evening. Over to you, Dr. Renner, for the final concluding remarks.
Yeah, I must say I'm very proud of the speakers and proud of the organization and proud of Sujit to manage this meeting. I think we've done very well, and I think we will put everything on our channel, which is Global Psychiatry Archives. You can Google it, or you should know it by now. So we're very proud of that. And I hope that we can have many more of these sessions. The Global Psychiatry has been founded on the idea that people from all over the world can contribute for the education. I think AI is very important. AI and mental health is something which is to be discussed more and more. And I think this has been an excellent starter. And I think maybe in some time we will come back to that. And I think Monica has, who's there, has done a great introduction, and she also organized and reorganized our agenda. So I think that's absolutely lovely, and it's thanks for everybody. And yeah, we will put this on the on YouTube, and I think everybody should be proud who contributed to that. And if anybody wants to join the Global Psychiatric Association, please go to www.globalpsychiatricassociation.com. Global Psychiatric Association is one word, and you can all contribute, and you can be contributing individually. We are doing everything for free, and but if someone wants to have a certificate, I think it's a bit of work to do that, and we charge $20 a pound for that. Thanks a lot. And I don't know, Monica, one sentence if you want to do on because you've done lots of the agenda. So the final word, which is possibly 10 words, then finish it off. Bye-bye and thank you. Okay.
Thank you, sir.
Thank you so much.
Is there somebody who's speaking?
You're
Yeah,
still
Muni.
there. We're still there, but you can a very short.
No, somebody was. Yeah. So, thank you very much for this wonderful, I think, conference. When we make the presentation, we come through so many things and we learn a lot. And I'm associated with Dr. Sujit from past 11 years now. And I know Dr. Reena from past, I think, 2 to 3 years now. And I'm meeting so many people, learning from them. And even your question, whatever you ask, it makes me look deep and ask myself that the more you know, the lesser you know. So that is my last message to all of you. If you have any kind of query regarding this, I will be very happy to help you. You can message me on my mail ID, that is Dr. Monica Thakur.ad@gmail.com. Thank you
Okay.
very much. Thank you, Dr. Reena. Thank you, Dr.
Okay.
Sujit Kar, and thank you, Dr.
Thank you.
Vipul.
Okay.
Thank you.
Bye-bye. Goodbye then.
Thank you.